Good morning and welcome to Rising. We've got a great show for you today. Robbie, what do we have?
Colin Rogero and Rena Shah are with us for panel. We'll discuss the state of our political system after headlines baiting a second civil war have been circulating online. And Batya Ungar-Sargon discusses cable news' low ratings last week on the anniversary of January 6th. But first, at this point in the pandemic, we all know someone who has COVID, or a friend of a friend who had it recently, cousins, etc. This was true in my family over the holidays. The first weeks of the new year have seen hundreds of first responders and essential workers call out sick, with an estimated 5 million Americans stuck at home because of COVID. These absences are leaving many businesses shorthanded and causing a major breakdown in basic functions, basic services. Hospitals are full. Lack of staff in New York City, trash pickup, subway delays across the country. Airports face TSA shortages, and schools are struggling to find teachers.
So infectious disease modeler and epidemiologist Jeffrey Shaman gave his opinion on Omicron's duration in the New York Times, saying, quote, "As we move deeper into January, it will be important to monitor whether the steep rise of Omicron cases is followed by a rapid decline." So projections from Shaman and his colleagues at Columbia expect to see the surge continue to climb until the end of the month, hitting 5 million cases during the worst week, but ranges from 3 to 8 million cases. And while the Omicron surge has brought case numbers up, deaths and hospitalization rates haven't risen as intensely as they did under the Delta variant. The Washington Post lays out a comparison between the Omicron and Delta here. You can see the orange line is the case numbers. Cases are at about 235% increase from January 2021, but current death rates are only 38% of that in January 2021. So that really is a pretty stark portrait right there.
Right. It never sounds good to say the death rate is only 38%.
Only 38% of what it was when many, many people were dying.
Right. I think we have seen, or we're about to see imminently, the peak in many of the places first hard hit by Omicron, D.C., New York, etc. I think you could still see, you're still going to see a lot of cases in other parts of the country that haven't gotten it yet. For the rest of the month, maybe heading into next month. And then it looks like we're going to see a huge precipitous drop-off. That's what they saw in South Africa.
Right.
And then, that hopefully then we're done. Right. but we've said that a million times. So
Fareed Zakaria, I think it was Fareed Zakaria, had an interesting line. He said, maybe we'll look back on this and see this as the first post-pandemic variant. I mean, obviously, we're still in a pandemic. People are dying around the world of an infectious disease. That's the dictionary definition of a pandemic. But as it becomes endemic, and if we continue to have variants, if they are, continuously kind of less deadly,
right, then
it's still the definition of a pandemic, but it loses the kind of the crisis mentality that it had. This is just anecdotal. In D.C., at least in our neighborhood, trash and recycle is Thursday. The recycle folks came last night. Not a crisis at all. It doesn't hurt my life, but it felt like the kind of thing that is reverberating through the entire system. Like, people are working as hard as they can. Sunday night, these dudes were out on the street picking up the recycling because they couldn't get it till Thursday, because I assume so many people were calling out sick.
Well, and you had, in D.C., obviously last week we had this horrible blizzard that shut.
Too. Yes.
So schools are being shut down because of the pandemic and the blizzard, and because they wanted to bring kids back in, or so they claim, but they wanted everybody to test first. But then it was like, well, there's a blizzard anyway. Maybe it's
right. So there ended up being one day last week of school.
Was there even one?
There was.
There was one day.
And so they were going to have 3.
Right.
And then the snow moved it to 2. Then they had school on Thursday, and then it snowed again on Friday.
Man.
But they're in school today.
Well, good. Meanwhile, in Greece, another variant has been discovered that combines the Delta and Omicron variants. The strain has been dubbed the Deltacron by a professor at the University of Cyprus, and have so far found 25 cases of the virus. Deltacron.
Deltacron.
That sounds like, like Alien versus Predator or something. Would you combine them together?
Right. Well, it's like, well, which traits does it combine?
Right.
If you combine the infectiousness of Omicron with the deadliness of Delta, then you have a super virus.
More powerful
and
virus.
Oh man, that really sucks. If you combine Delta's infectiousness, which, remember, we were panicked about it because it was so much more infectious than Alpha,
right.
but it's much less than Omicron. If you combine that with the kind of less virulent, less deadly nature of Omicron, then actually that's a positive development. Because what you ultimately want is something that is extremely contagious and harmless.
I mean, what you ultimately want is nothing. But
that is
when
nothing.
You have to, right.
Like there are so many viruses that are going through the world right now that are extremely contagious that we don't even know about, that we have.
And that's basically where we're at, where we're getting to. Some people are behaving like that, a lot of people aren't. But it is, if you've gotten vaccinated, if you're not someone with severe, immune system deficiencies, then for you, this experience will be somewhere between so mild you might not even realize you have it or feel it at all, and a bad bout with a cold or flu. And that's the experience most people have.
And this would be an amazing moment for us to reflect on our overall public health. Mm-hmm. And even the left gets, I think, to my mind, some blame here too by focusing exclusively on the insurance delivery system, like just focusing on trying to make sure that all insurance payments are public through Medicare for all. That's great, and everybody needs insurance, but we're spending like 4 or 5 times more than Costa Rica spends on its healthcare and getting worse objective outcomes. Like not relative outcomes when you control for wealth, but just straight up across the board. Like they're healthier in Costa Rica because they take a public health approach. And here in the United States, public health is explicitly carved out of our insurance coverage. There was this amazing moment where this insurance company said, if you're getting a vaccine for a public health purpose, which is like travel or just making sure the world is less sick, then it's not covered. Not covered for public health purposes. We don't do that. That's on the public. But the public doesn't do it either.
We're not thinking about the total public health picture. I mean, the mitigation efforts we've gone through have had some really awful side effects in terms of people's mental health.
They've made public health worse.
The fraying of the social fabric.
Physical health.
People, Matt Iglesias' Substack this morning, I was reading it, and he was saying that there's a lot of. It's hard to measure exactly but like disciplinary issues in schools that are open are worse. There's been more car accidents. There's more angry people on play. There's just more anger and frustration that does get people killed. In some cases, it's some in the extremes, and like we're going to be living with that for a while to come.
And the number of overdoses and fentanyl poisonings is just through the roof.
Yeah. The crime, everything. A lot of bad stuff getting worse. And I have to think that the conditions we've been under for the last 2 years have something to do with that.
No doubt about it.
Yeah. But coming up next, we'll tell you what's on our radar. Stick around for that.